My name's Natalie and I'm the nurse practitioner student examining you today. We're going to do a full head-to-toe assessment. I'm going to start by just taking a look at your hair and your head. Alright, so we're going to first start with the eye exam. We're going to test your visual acuity first. I'm going to have you cover your right eye and read the last line on this card.
CDEZXYA.
Alright, now I'm going to have you cover your left eye. Read the smallest line on this card.
CDEZXYA.
Okay, and then now we'll do with both eyes. Read the smallest line that you can read.
CDEZXYA.
Okay, very good. Now I'm just going to take a look at your eyes. Just take a look at the sclera, the conjunctiva. Looks good. Okay, very nice. Now I'm going to use a light, and I'm just going to test your response to the light, okay? So just look straight ahead at me, okay? Okay. Very good. Okay. Now we're going to do some visual fields. I'm going to have you look at this and just follow my finger. Very good. Now I'm going to have you close your eyes. And now open them. Okay, no lid lag. Perfect. Okay. Now I'm going to use this to look at your eye, okay? Just look straight ahead. Okay. Now I'm going to take a look at your ears. I'm just going to feel the external part of your ear. Any tenderness?
Nope.
Okay. Perfect. Now I'm going to take a look inside your ears. Now we're going to do some hearing tests, okay? We're going to start with the whisper test. I'm going to stand back here and whisper something, and you tell me what I say.
Cat. Dog.
Okay. Now we're going to do a test. I'm going to hit the tuning fork, and I'm going to put it on the middle of your forehead, and you tell me if you hear it better in the left, right, or if you hear it equally in both, okay?
Both.
Okay, very good. Now I'm going to do a separate test on both ears. I'm going to hit the tuning fork and put it against your bone, and you tell me when you can no longer hear it, and then I'll put it in front of your ear, and you tell me when you can no longer hear it, okay?
Can't hear it anymore. Yep.
Okay. Now we're going to do the other ear.
Can't hear it anymore. I can hear it.
Okay. Perfect. Now I'm just going to take a look at your nose. I'm going to use my light. Okay, very good. I'm going to take a feel and feel your sinuses, okay? And you just tell me if you feel any tenderness at all.
Nope. Nope.
None?
None.
Okay. Now I'm going to kind of tap on your forehead and feel, and you tell me if you feel any tenderness then too.
Nope.
Now now I'm going to shine a light through your sinus, and you're going to open your mouth, and I'm just going to see if there's any light shining through, okay? Right? Okay. Very good. Now we're just going to take a look at the inside of your mouth, okay?
Mm-hmm.
Can you just open wide? Ah.
Ah.
Alright, just taking a look at your buccal mucosa, your tongue. Can you say ah, stick your tongue out? Okay. Tonsils, 2+, okay. Okay. Can you stick out your tongue and twist it around? Okay, cranial nerve 12. Perfect. And now I'm going to feel your lymph nodes, okay?
Mm-hmm.
Alright, I'm going to feel your preauricular, postauricular, occipital, your tonsillar, submandibular, submental, occipital, supraclavicular. Alright. Now I'm just going to take a look at your neck. Alright, your trachea is midline. Now I'm going to kind of have you turn to the side and I'm going to feel your thyroid, okay? And I'll ask you to swallow. Kind of move your body over this way. Alright, now swallow. Okay, no thyroid megaly. Alright. Now we're kind of going to go over the cranial nerves that we didn't go over at the beginning. I'm going to have you close your eyes. I'm going to have this cup in front of you, and you're going to tell me what is inside of it, okay? What's that smell?
Coffee.
Okay, perfect. We already did cranial nerve 2, 3, 4, and 6 when we did your eye exam. I'm going to do cranial nerve 5 right now. I'm going to have you close your eyes, and I'm going to touch your face, and you point to where I touched you, okay?
Mm-hmm.
Okay, close your eyes. Okay. Alright, now I'm going to have you open your eyes, and have you look to the side, test your corneal reflex, okay? And then I'm going to have you look the other way. Okay? Corneal reflex intact. We already tested cranial nerve 8. We did all the hearing tests. We already looked in the inside of your mouth. Your gag reflex is intact and you swallowed. Now I'm just going to have you shrug your shoulders to test cranial nerve 11. Okay, perfect. And stick out your tongue one more time and wiggle it around. Okay, perfect. Now we're going to test some motor strength and muscle. Okay?
Mm-hmm.
So we are going to start by, I'm just going to take a look at your muscles. You have good muscle tone. Alright. I'm going to have you do some rapid alternating movements. So I'm going to have you go like this over and over again. Very good. Okay. Now we're going to do some point-to-point movements. I'm going to have my hand right here. You're going to do nose to finger over and over again. And then I'll have you close your eyes and do it. Okay, perfect. Now let's do the other hand. Now close your eyes. Perfect. I'm going to test some muscle strength. So I'm going to put my hands like this while you pull forward. Okay, now push. Okay, now pull. Push. Perfect. Now push. Okay, pull. There we go. Now put your heels up like this. Push. Pull. Very good. Alright, now we are going to test your gait. I'm going to have you do some heel to toe walking. So just walk towards like this. Okay, perfect. Alright, actually one more standing test. Then now I'm going to have your heels. And I'm going to have your feet and arms like this. And close your eyes. Perfect. You can sit back down. Now we are going to test some sensory function. I'm going to show you sharp and dull. You tell me, you're going to have your eyes closed, and you tell me when you feel sharp or dull. Let's practice. This is going to be sharp.
Okay.
And this is dull. Ready?
Dull. Sharp. sharp, dull, sharp, dull, 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 sharp, sharp, dull, sharp, 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 dull.
Perfect. Now I'm going to test some vibrations. You tell me if you can feel them, okay?
Okay. Yep. Mhm. Mhm. No. Yep.
Very good. Okay. Now we're going to test some discriminative sensations. I'm going to have you identify an object placed in your hand, okay?
Mhm.
Will you close your eyes for me?
It's a pen.
Perfect. Open your eyes. Now I'm going to have you have your hand out, and I'm going to draw a number in your hand, and you tell me what number I drew, okay?
Mhm. 7.
All right, let's do the other hand.
2.
Perfect. Now, I'm going to have you close your eyes, and I'm going to touch you, and you tell me where I touched you, okay?
Mhm. Right arm. Left leg. Right leg.
Okay, perfect. Now we're going to test your reflexes, okay? We'll start by doing your bicep reflex. I'm just going to hold your arm, and you just hold it loose, okay?
Mhm.
Perfect. Okay. Perfect. Now I'm going to try your tricep reflex. I'm just going to have you hang your arm like this. Perfect. Perfect. All right. Now I'm going to have you sit in this chair so your feet can dangle, and I'm going to test your patella reflex, okay? Perfect. Perfect. All right.
What?
Now I'm going to have you just hang with your knee, with your leg hanging over like that. And I'm going to do your Achilles tendon. Perfect. Now we'll do the other one. Perfect. Okay. Now you can sit back down. All right. The only other thing we're going to do is I'm going to grab the bottom of your foot and I'm going to stroke it. Okay? Just testing the Babinski reflex. Okay? Now we're going to move on to the respiratory exam. I'm just going to take a look at your chest, okay? Perfect. You have symmetrical respiratory movement. I'm going to feel your respiratory expansion, so I'm going to have you turn to the side kind of. And I'm going to put my hands like this, and I'm going to have you take a deep breath. Perfect. Okay, now I'm going to put my hands on your back, and I'm going to have you say 99 each time, okay?
Mhm. 99. 99. 99, 99, 99, 99, 99, 99.
All right, we're going to do the same to the front.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Now we are going, I'm just going to percuss your chest, okay? Same thing as earlier. Okay. All right, we have resonance on percussion. Now I'm going to just take a listen, okay?